My name is Mohammed Ashori, MD. I'm a board-certified family medicine physician talking about healthy aging. And one of the things that I like to prevent as much as possible is this neurocognitive decline in my clients. And the way we do that is not by doing word puzzles and word games and reading the newspaper. Actually, doing that is not going to change the outcome. Meaning, if we take somebody who might have had a very physical job all their life, and we add a bunch of mental reasoning and tasks into their life, they're not going to have a better outcome when they eventually do develop dementia. Another way to think about it is, well, at least being able to hold your attention for much longer in general, because let's say you're a CPA or a physician or an attorney where you've had to do a lot of thinking. Well, it's much more likely that when you do develop dementia, it's just not going to be obvious to many people. Well, the goal is not for you to develop dementia and just hide the symptoms. The goal is to simply not go down that of what we call mild cognitive impairment, which are the first few signs of dementia. We know that there are a few ways to ensure that your risk of dementia is lower. There are certain blood tests, genetic tests that we can do to help us determine if you're at risk for developing dementia. And that's a great place to start. Absolutely. Get those tests done with your physician. But there are also things you can do in your daily routine that can drastically decrease the risk of developing it. The most important by far is good cardiovascular health. And what I mean by that is making sure that the brain, which is affected in dementia, gets adequate blood supply, because one of the causes of dementia is what we call multi-infarct dementia, where small parts of the brain maybe don't get enough oxygen, plaque develops in those arteries, and those parts become less effective and they degenerate. So that is probably the most important thing, and that has a lot to do with your cholesterol level and your blood pressure, which can, of course, be affected by your lifestyle habits. Exercise seems to be very effective for many reasons. Not only is it the aerobic capacity of exercise of bringing more oxygen to tissue, such as the brain, but maybe also creating chemical signals that decrease inflammation and prevent damage of those very sensitive nerve cells, but also the ability to do an exercise, to lift the weight and kind of feel the movement and to coordinate yourself as you're running and swimming and playing tennis and cycling, rock climbing. Those things are also very powerful ways for your brain to actually become more resilient. And the last one is your diet. It's probably much more important that you're getting the good stuff in your diet than cutting out the bad stuff. So what do I mean by that? Let's say you're one of those people who just loves your alcohol, you love your burgers, you love your fatty deep fried foods. When it comes to dementia, it's more important that you're just having some good natural whole vegetables, some good quality fruits, and other lean, good quality meats. That's much more important than you cutting out the bad stuff. And now, in certain other conditions like obesity and blood pressure, it might be necessary to attack both sides. But when it comes to dementia prevention, introducing the good stuff is much more important. That's my list to help prevent dementia, to delay dementia, to decrease the risk of mild cognitive impairment. Tell me a little bit about your concerns. Are you worried about dementia? And what are some of the things that you're doing in your life to age healthy and prevent dementia?